Terms to know. Are we ready?
Yeah.
Let's see what you know. All right, so we're gonna talk lung sounds. What are crackles? So fluid and air together make a crackle noise, right? Because in your alveoli, there's just supposed to be gas, right? Because it's gas exchange. But when you add water to it, it makes bubbles, right? Which is you're going to hear crackling noises. Give me examples of patients you would hear crackles in. Pneumonia. Oh, good. Keep going.
Would you hear it with COPD?
Absolutely. COPD, because they got a lot of mucus production, which means you may hear it in asthma. You may hear it in congestive heart failure because all that fluid backs up to their lungs. Yeah.
Yeah.
So crackles just mean there's fluid in the alveoli. So are we gas exchanging? Super great.
No.
Not super great because there's not supposed to be water up in there. Yeah. All right. What does wheezing mean? These are very basic questions.
Bronchoconstriction.
Means there's bronchoconstriction. So your airways are tight, swollen, inflamed. Who wheezes? Asthma. Anybody else? What did you say? Oh, they won't wheeze. They shouldn't. What about anaphylaxis? Because that's an allergic response, right? Okay. What is Rhonchi? Junky noises. It's not really crackles. Like it's not, it's just, they sound junky. Okay. Because crackles are very distinct. Like you can hear like, but if they're breathing, it's like that noise. And I'm just like, that's the wrong guy.
I like the whooping cough.
No, whooping cough is a paroxysmal cough. There's just a dry cough. Rhonchi, you'll just hear junky sounds. Like if they have a virus, a cold, something, you may hear some junk. If they've got COPD, you may hear junk because they got lots of mucus in there, right? Right, cool. What is stridor?
Yeah.
Yes.
Yeah.
It is. Where's that coming from? Yeah, that's just upper airway. So who would have super like problems right here?
Choking?
Yes, if they have a foreign body obstruction. There's also a kid illness called croup. Y'all heard of croup?
Yes.
That causes really big swelling right here. So stridor is upper airway. And it means like this airway right here is like swelling or obstructed.
Okay.
Okay. All right. What is a normal respiratory rate in a patient? 12 to 20. Okay, that's good. Normal heart rate. 60 to 100. And the ending PNEA will always mean something with breathing. All right. Let's talk about signs of respiratory distress. How do you know your patient is not doing well? Okay. What's wrong down there?
What did you for wheezing?
Bronchoconstriction. Yeah. Asthma, sometimes COPD, anaphylaxis. All right. Signs of respiratory distress. Tachypnea. What is tachypnea? Fast breathing. They're trying to compensate. Yes. So that would be a respiratory rate greater than 20, but probably higher than that.
Yeah.
Yeah. Okay. Okay. Y'all get what I'm saying. What is dyspnea? They're having trouble breathing. What are retractions? What kind of muscles? Not abdominal, but they're between your ribs. So those are called intercostal muscles. You're using your accessory muscles to breathe. So they are working so hard to breathe that their muscles, you can see them here too. Yeah, like supraclavicular. You can see them intercostal. Okay, those are like, you're pulling really hard to breathe. Okay, so if you see retractions, you're like, oh, yeah. Diaphoresis. What does diaphoresis mean? Sweating. If you are working so hard to breathe that you are breaking a sweat, you are having a bad day. Okay. Hypoxia. Oh. Low oxygen in the tissues of the cells. Cyanosis. You're turning blue because of hypoxia. Yeah. What is tachycardia? Fast heart rate. Why would you have that for respiratory distress?
You're nervous.
You're panicking because you don't have enough oxygen, and your heart is trying to compensate, saying, oh, you don't have enough oxygen, let me pump some more blood out to you and you can get some more oxygen. Yeah. What is orthopnea?
You have to sit up to breathe.
Yes, that is you have to sit like ortho, like, we move. And PNEA means breathing. So in order to breathe, you have to be sitting upright. So patients have a lot of junk in their chest, right? They got a lot of mucus, they have a lot of fluid, and they lay flat. What happens to all that fluid? It's going to sit and they can't breathe. So they have to sit up to breathe. What is the one question I ask to determine the degree of orthopnea? How many pillows do you sleep on at nighttime? If they say, oh, I just sleep on one, you're like, you don't have orthopnea. If they're like, oh my gosh, I have to sleep on 6 pillows or I can't breathe, you're like, oh, yeah. Okay. All right. What is atelectasis? The bottom of the lungs stick together, partial collapse of the lung. Okay. What is the consequence of atelectasis? They can end up getting pneumonia. And where are your alveoli? Where's the atelectasis? Oh no. Are we going to gas exchange super well? No, we are not. No, we are not. It's a sad tale, really. All right. What does expectoration mean? If I say the patient is expectorating. No, I mean, I want them to breathe, but. Okay, if you go to Walgreens and you pick up an expectorant,
makes you cough.
makes you cough. Expectorating means to cough. What is hemoptysis? Coughing up blood, because hemo means blood. Ptosis just means cough. So cough. Yep. Okay. Yeah. What are Kussmaul's breathing? It happens in DK. Oh, what is it?
It's like really
Deep,
right?
rapid breathing.
Yeah.
Who Kussmaul's breathes? Why DKA? What is DKA? Diabetic ketoacidosis. And since diabetes is what type of problem? Metabolic, who kicks in? The respiratory system. So they're like, I got you. What are you trying to do? They're trying to breathe out their CO2. And this is a pattern that they naturally go into. It's not like you have to teach them how to do this. Their body naturally does this. So if you go into the room of a patient with DKA, that's what you're going to see. They're trying to breathe in more base and get rid of acid. Do not do this. 10 out of 10. Would not recommend. Okay. I know it makes you really dizzy, right? Yeah. Okay. What is Cheyne-Stokes breathing? That's part of it. Okay, yeah. So Cheyne-Stokes breathing is like right before death breathing. So their breathing is all over the place. It goes fast, it goes slow, and then they have periods of apnea, right? Because there's no longer, they're not regulating the respiration rate anymore. So you'll see like, and everybody's like, oh my God, are they gone? Are they gone? Are they gone? Nope, not yet. Okay, so it is all over the place because they're no longer regulating respiratory rate. You understand? It'll go fast and it'll go slow. Then they'll have periods of apnea. What is apnea? They're not breathing at all. Okay, usually we don't consider it apnea until they are not breathing for more than 15 seconds or any period of time if they also have bradycardia. Because if they're not breathing for 7 seconds, all of a sudden their heart rate plummets, what does that tell me? They're hypoxic already. Okay. You understand your basic terms and how to use them.